All right. Good morning, everyone. And thank you all for joining us for today's panel discussion. My name is Stephanie Gaywood. I'm the Director of Community Engagement and Community Fund with the Oakland Athletics. Today, we'll discuss how MLB, the Giants, and the A's have used our platform to raise awareness and funds for HIV and AIDS with our prestigious guest panelists, Major League Baseball's Vice President and Senior Advisor to the Commissioner Ambassador for Inclusion, Billy Bean, the CEO and co-founder of the Oakland LGBTQ Community Center, Joe Hawkins, and the Executive Director of Until There's a Cure, Nora, Hanna. And joining me and welcoming our panelists today and moderator is Roscoe Mapps, Vice President of External Affairs at the San Francisco Giants. Oakland Athletics take an innovative and dynamic approach to improve the quality of life in Oakland and the East Bay. Through education programs, youth sports initiatives, and various volunteer efforts, the A's are committed to making the community more equitable and inclusive. We are committed to the health, vitality, and happiness in our community. And with our community partner, the Oakland LGBTQ Center, we're able to use our platform to raise awareness on this cause. Before I turn it over to Roscoe, I wanted to share a couple housekeeping notes. We will have a few minutes towards the end of the discussion for questions, but please use the Q&A box in the Zoom control panel to submit your questions at any time. We will do our best to get to everyone's questions. And at the end of the webinar, we will send everyone important links with additional resources from all of the panelists. Now, please join me in welcoming today's moderator, Roscoe Mapps.
Thank you, Stephanie. Good morning, everyone. It's glad you're able to join us. My name is Roscoe Mapps. As Stephanie said, I am the Vice President of External Affairs for the San Francisco Giants, and we are thrilled to co-moderate this panel today. The Giants, for a number of decades, have used our various platforms from television, social media, radio, the ballpark, to help educate our fans and to tell the stories about the extraordinary organizations like Until There's a Cure, who's here today with us, the International AIDS Conference, and the San Francisco AIDS Foundation. These organizations are providing life-saving funding, education, programs, services, and advocacy to support our communities. And every season, the Giants get the opportunity to ask our fans and our followers to take action with us. Now, Stephanie, as you know, our ball clubs have a historic rivalry. And when our teams are on the field, we are fierce competitors. But off the field, we are allies in this fight to ensure that everyone who is living with HIV and AIDS is seen, is heard, and is able to live their lives with dignity and in good health. And that's the theme of the conference this week, resilience. And so the Giants, on behalf of the Giants, we couldn't be more honored to join the Oakland Athletics at AIDS 2020. And Stephanie, I am honored to join you in welcoming the attendees and our panelists. So without further ado, I'd like to ask the panelists if they'd start by individually taking some time to introduce themselves, their organizations, and the future of their work. And why don't we begin with Joe of the Oakland LGBTQ Center, and then move over to Nora and then Billy. Joe?
Hello, everyone, and thank you for welcoming me and the Oakland LGBTQ Community Center to this panel. The mission of our organization is that we're dedicated to enhancing and sustaining the well-being of lesbian, gay, bisexual, transgender, and queer individuals, our families, and allies. And we do this by providing educational, social, and health-related activities, programs, and services. So we serve families and youth to elders. So it's a broad range of service provision. Just to tell you a little bit about myself, back in the 80s, I was serving in the United States Army, and I was actually one of the first cohorts tested for HIV in the United States Army. And when I was about to be tested, well, our platoon was about to be tested, I panicked. I had a anxiety attack, and I was terrified because I knew that I had feelings about men. I had not come out yet. And I thought that I had it. And my friends were laughing at me who were gay. and they said, have you ever had sex with any guys yet? And I said, no. And I said, but I think about it, so I'm sure I have it. One of my friends who laughed at me later tested positive, and he is dead now. But I left the military because I was very clear that at that time there would not be a place for me to be the soldier that I wanted to be back then, because of the rules and guidelines and laws around gay people serving in the military at that time. And after I left the military, I became an activist, and I was very, very concerned about what I was seeing on the streets, but not seeing on the news. And it was about how HIV and AIDS was affecting the African-American community. And here in Oakland, I would watch money go right over our city to San Francisco while I watched people in our city dying. And that led to me creating a lot of services, including the service where I am today at the Oakland LGBTQ Community Center. So, and we're still doing that work. So that's me. Should I continue? Moderator, what's
Well,
next?
no, sorry, I was on mute. Thank you, Joe. That's an incredible history you have. I want to pivot over to Nora, where maybe you can tell us a little bit about your work with Until There's a Cure.
I'm Nora Hanna. I have been with Until There's a Cure since 2012. I became the executive director in 2011. Our foundation was founded in 1993 by two moms who had a simple idea: sell a bracelet, raise funds and awareness for a disease. And since 1993, we've reinvested over $23 million in the cause. We have been very fortunate in partnering with the San Francisco Giants for the last 27 years, giving us a day and a platform to raise funds and awareness and to continue the fight. How our organization has changed over the 27 years is we're still committed to finding a cure. We're still committed to vaccine research and development, direct care services, prevention, education. But HIV in 2020 is not HIV in 1993. And being diagnosed is not a death sentence. And it is one part of a person. It does not make an entire person. So we, in 2014, took an approach of looking at HIV and social injustices and how they intersect. So we look at race, stigma, housing, mental health, drug use, domestic violence, and really try and wrap our head around how can we have an impact? What can we do going forward to change this? We've worked in the prison system with formerly incarcerated people and their housing needs that are going unmet. We've worked with sex workers. We have worked with homeless youth, mental health. So we really are approaching HIV as one spoke in a wheel that makes up a person. And that's how we continue. We work with over 350 agencies in the United States. About 60% of our product is made all over the world by people living with the disease. So we really are trying to uplift, embrace, empower, and educate the artisans that we're buying our merchandise from. And that's what we're doing.
Thank you, Nora. Billy, from what I understand, you've got a pretty unique connection to Until There's a Cure Day at Oracle Park, and I think it was Candlestick back then.
It was definitely Candlestick back then. It was a long time ago, but yeah. So Roscoe and Stephanie are so humbled to be invited to be here today alongside Joe and Nora, who dedicated their lives to helping and serving. And so today, to share a little bit about me, currently I'm Vice President and Special Assistant to the Commissioner for Major League Baseball. And I oversee some education programming that is an incredible progressive change from what baseball was like when I was a player. So a little about my personal story. I played 6 years in the major leagues, and during that time, I was living a double life. For all those that are watching today, baseball is entering its 151st year of existence, and there have been only 2 major league players who have ever publicly disclosed that they are gay. A player named Glenberg, who played for the Oakland Athletics and the Los Angeles Dodgers, and myself. And it's a interesting perspective of the culture of professional sports and the way baseball used to be. When I was a player, I was hiding my sexual orientation from my family. I grew up in a very conservative religious family, the oldest of 5 boys. My dad was in the Marine Corps. I don't think I ever met anybody that told me that they were gay until I was in the major leagues, you know, growing up in the 70s and 80s. And when I just about thought I was being able to navigate or manage this secret, because there was never an example or an accepting message that was being conveyed by baseball or any of the pro sports at that time, my partner died of HIV-related causes on the night before what was to be my last season in the opening day of 1995. And as you said, Roscoe, the just twist of fate and great irony of Nora and my connection into this moment, this conference. I was a player for the San Diego Padres. We used to play the Giants all the time. Giants had some great teams in those years. So I remember specifically seeing Until There's a Cure night. I think 1994 was the first one that the Giants hosted. And I could not, I'd always been able to separate my personal life and my baseball career. I don't know why I was good at sports and able to overcome the obstacles that many of us in my community have faced in those days in team sports, but I was able to do so. But when my partner passed away, it really took a devastating toll on me. And the medical advice I got at that time was basically under the assumption that because I was with my partner for 3 years, that I would become HIV positive and have the same fate that he did. And going to the park in 1995 was a tremendous challenge, playing with that secret looming over my mind. I never trusted anybody in my own community for advice. I was only measuring myself as a Major League Baseball player. And if I was good on the field, then I was a good person off the field. And if that didn't happen, then I was a failure. Living in shame, all those kinds of things that really shaped and ended my career early. And I ended up walking away. And luckily, as I got to know some great heroes like Joe and Nora, who are allies and LGBT members of the community, I made my way back and started living a truthful life and being able to be more visible, live honestly. I was around many, many different experiences that are supportive and championing civil rights education and causes, and that brought me back to baseball. So today it's just a real privilege to be here to support the amazing organizations that are on the panel, and look forward to sharing some of the work we're doing in Major League Baseball to educate our players.
Thank you, Billy. Billy, Joe, your personal stories are just so moving and shared by many. So thank you for having the courage to kind of share your personal experience. And Nora, the work that you've done Until There's a Cure has just been so compelling over the years. I want to kind of pivot just a little bit. And Joe, I'm going to throw this back to you, but I think we should really take advantage of the important moment we have today to sort of center this conversation in the context of Black and Indigenous people, in the context of Black Lives Matter, and in the context of the movement going on to elevate the Black community and other communities of color who have historically had less access to critical resources. And Joe, I wonder if you could get us started on a conversation of how we address these inequities as we move closer to achieving health justice. What does it mean to prioritize communities of color when discussing resource allocation, and why is it so important?
Well, you can look no further than the HIV epidemic, which remains a major problem for Black and Brown people in our country, and particularly Black, gay, bisexual men and transgender people. The intersection of race creates additional barriers to access to healthcare, medication, a proximity to higher infection rates. When I first started doing HIV work in the late 80s, early 90s, there was, our voices were muted because of the color of our skin. White male voices, because they are the sons of white people, the daughters of white people, the grandchildren of white people, and I don't want to diminish the fight that they waged, but it brought many resources to bear on the issues affecting white queer people. And we were at the time dying just as rapidly. And today we can see how the neglect of our communities has now resulted in Black people, African Americans, making up more than 40% of all people with HIV in the United States, even though we only represent 12 to 13% of the US population. And the Centers for Disease Control and Prevention has projected that 1 in 2 Black, gay, or bisexual men will become infected with HIV in their lifetimes if current trends persist. So it is very clear that in the context of Black Lives Matters, that we are aware that that police brutality is killing us and HIV is still killing us. And we have to put resources to that issue in a way that we did when white gay men were saying their lives matter.
If you just look at the availability of PrEP in the Black community, 75% of all PrEP prescriptions are for white, gay, bisexual, trans, and it is not getting into the Black community. There is not an access to PrEP, which will save lives.
Nora, for our guests, can you tell everybody what PrEP is?
So PrEP is, we like to say it is the game changer. You take PrEP daily, it's pre-exposure, and then there's PEP, which is post-exposure, to help, stop HIV infections. It is widely available, except for in communities of color. And that is, you can look at the numbers and see where the prescriptions go. They're white, so it's racist. And that needs to change in order to help stop the spread of HIV.
Oscar, I would
And
like to add that it's interesting that the devastation of the statistics that Joe was sharing, when you start talking about the relation of what systemic racism is about and what it means and the effects, these are the casualties that exist when there's a break in the chain of communication, broad caring for all people in an equitable and fair way. And I think we're coming through a devastating moment where the murder of George Floyd on May 25th in Minneapolis just might be the seminal moment where the understanding that does go into the white communities and people of privilege, understanding why it's essential that we are all in the same page and supporting, because it does affect all of us unless everyone is safe. And that conversation, it's been very interesting to see in the sports world, the automatic switch where every athlete now understands the privilege and the responsibility with the platform that they have and the impact that they can have. Whereas before, for some reason, it just seemed like there was a reticence to rock the boat or be a martyr. And I think that the one glimpse of light that can come happening right now through a myriad of difficulties, the pandemic, the HIV crisis, a cultural shift that is so long overdue, that communication and the integration of multiple conversations happening by supporting the Black Lives Matter movement, people are going to see positive outcomes.
I also want to thank you both, Nora and Billy, for your comments. And I think what we have to understand too is that resources equal power. Recently, my co-founder and I co-founded the Oakland LGBTQ Center, one of the few all-inclusive LGBTQ centers co-founded and led by Black people. We're Black queer people who know our communities. And although white queer people share in our oppression, they are still beneficiaries of white supremacy and the behaviors associated with white supremacy. And so if the queer spaces in the spaces, and we're talking about trying to find ways to get to zero for HIV infections in Black communities, we need the resources that will go to Black leaders to help to do that, to Black communities. And until recently, I wrote a proposal for a $4 million grant over 4 years to create a clinic here at the center. It was to the state of California Office of AIDS. And fortunately, we were able to get that contract. So right now, we're in the process of opening a clinic that will cater to the cultural needs and of primarily Black and brown people. Although all people will be welcome, that will be the focus of our programming, but that came out of a Black mind, okay? And more programming to help stop this epidemic in our communities need to come from us. And we need the support of everyone, because that's what happened with white gay men. That helped them to reduce their numbers. We need the same focus under Black leadership, and Black leaders have to be identified to who are in these communities who can help make a difference. Already, right now, I am writing checks to help people pay their rent. And as Nora pointed out about the whole person, here at LGBTQ centers across the country, it's not just about HIV. It's about people's mental health. It's about their connection to their community. It's about being rejected by their families and having to create whole new families. That it's more than just HIV, but if you're a Black person and you walk into an agency, you see nothing but white people, that does something to you. And when you come to a center like ours and you see a lot of Black people and the other people, that will also do something to your spirit, just to you as a Black or brown person. So.
Yeah, I think that's profound. Joe, can you talk a little bit more about some of the partnerships you'd mentioned? Obviously, you've been working with the Oakland Athletics, but can you talk about some of the other partnerships you have in this effort?
Yeah, we have, God, like I literally have to look at our sponsorship page because we've been very, very supported by Gilead, the Warriors, of course, the Oakland Athletics, Google, Wells Fargo. The list literally goes on. Recently, our center was vandalized during San Francisco Pride Week. And the San Jose Sharks just stepped up to repair the damage that was done by someone who was extremely, obviously homophobic and broke our windows out. And this was just last week. So the community is definitely supportive. And the partnerships range from state to corporations to small businesses to individuals. So we've been fortunate that we are getting the support from the community, but it took, there was no LGBTQ center in Oakland for a reason. And this, I've been here for over 30 years. And what I believe is there was San Francisco across the bridge. And as long as there's San Francisco across the bridge, people feel like that's the gay Mecca. But it has not been the Mecca for Black folks. And so that's why now our center here in Oakland is being embraced so widely and so enthusiastically, is because finally in cities like Oakland, we have our own centers that reflect the cultural need and ethnic needs of our community.
Roscoe, I would, to back Joe's point, representation is so vital, and in people seeing role models in front of them. There was never a conversation about LGBTQ acceptance or inclusion or respect in baseball before the commissioner brought me back to initiate those conversations. But I was a former player walking into a clubhouse, talking to players and sharing a life experience that they could see on video from the MLB archives. So representation, my family never had one concern for LGBTQ plus community or people, for people dying of HIV, living with HIV, until they found out that their oldest child was a member of the community. So the intersection of representation and the impact that can make, and why Joe's presence is so profoundly impactful. We won't even see it completely in his lifetime, but the image of that center. And I would love for Joe to share what his goal is about naming a new part of his center. It's a magical connection between he and I, and he deserves to share it, but it will be perfectly aligned with that ideal about the importance of representation and honoring someone's life.
I want to thank you, Billy, for throwing the ball to me. And and I want to thank you for connecting me with the family of the person that I'm about to talk about. I was, some years ago, I saw a documentary about a baseball player from Oakland, Oakland native named Glenberg, who was an outstanding player, a colorful player, who played for the Oakland A's and the Los Angeles Dodgers. And when I watched that documentary, I saw here was an African-American man, the first Black man to ever come out and who was a member of the Major League Baseball, a Major League Baseball player, and he was unapologetically gay, and he didn't hide it, and he lived his life openly. Now, there were consequences to that for Glenberg. He was pretty much blackballed out of Major League Baseball. And the saddest thing was that Glenberg ended up on drugs, on the streets, and sick with HIV, which later progressed to AIDS, and he died of AIDS. But what was also powerful was that there's a point in the documentary where the Major League Baseball Association sent someone to look for Glenberg. And when the woman who was sent to the Castro to find him saw him, when he saw her, he said, "I hear someone's here to help me. I can't believe someone's here to help me." I have heard that many times in my work, working with LGBTQ people and people who are on drugs and living with HIV and AIDS. And our goal is to name our new clinic the Glenberg Wellness Clinic. And we've been in discussions, thanks to Billy, with the family of Glenberg, who are excited about it. So we're hoping by September, we'll be opening the Glenberg Wellness Clinic. And when people come for help, they won't be surprised that we're there for them. So that's our goal with the clinic, to keep
Joe,
his
the
name.
Oakland A's employee was an amazing woman named Pamela Pitts. So,
She's amazing. She
yeah,
is amazing.
and that reconnected Glenn with his family, and they were able to help support the Oakland A's. Deserve a ton of credit for that. That was doing, life-changing good deeds when no one was looking, and no one was looking for press. It was about love and being a part of a family, and it's an amazing story. And his family, the reason Glenn was so defiant is because he grew up in a loving, accepting family, and they never told him otherwise, that it was, the messages were not crossed, that it's bad to be, part of the LGBTQ community. And I think to his, his own naivete and innocence and, self-confidence, and being so good at sports as such a young man, as you said, baseball wasn't ready for him in 1977. He was so far ahead of his time, because most of us were completely guarded, as I certainly was. I was never as brave as Glenn was in the same situation, but I'm really, really excited about the naming of the center.
Yes, and yet we are too. And I just want to say to you too, Billy, how inspired we are by you, because isn't it interesting that only 2 people have come out, and your bravery is commendable, and as a gay man during our time, we're probably around the same age. It just wasn't easy. I was a dad back then. I'm sure you guys will be sharing the links to my bio, but I never came out because I was so proud to be gay. That's not how I came out. And for me, I came out after I left the military because my son's mother was killed in a fire. And when they tried to take my son from me, I ended up on national television fighting for my right to keep my son. Now, I bring that up because Glenberg had a loving Black family, but in many families in the Black community, being Black and gay is not a good thing. And so when you're between two pillars, there's a pillar of homophobia and transphobia on one end from huge numbers in our Black community. And then on the other end, there's racism from the mainstream community and from the white queer community. So, you know, these all fuel the fire of drug addiction, HIV and AIDS, and mental health issues, homelessness across the board. So it is something that we're working to make a difference in here in Oakland, and I believe other people around the country are working to do the same.
Thank you, gentlemen. I want to toss it over to Stephanie so we can get a couple of questions in. We've got about 10 minutes left in the discussion. This has been great. Stephanie.
Yeah. Please feel free to add additional questions through the chat. But Nora, I wanted to be able to start with you. During the whole time of like the social injustice in the movement, a lot of people ask like, well, how can I help? Like, what can I necessarily do to be the change? And like with the stats that Joe's provided, with the insight that Billy has provided, and gentlemen, always please feel free to also chime in as well with some of your responses. What would you suggest to the people tuning in today of how they can help close that gap on resources or provide resources or awareness or fundraising? Like, what would you think, Nora? You're on mute.
Nora, are you on mute?
Nora on mute. There you go.
Sorry. One of the things that we really focused in on was housing. Housing is a huge problem. And it is a huge problem for people that are coming out of situations where they need to go into public housing or Section 8 housing. And we really, as a community, need to talk to our representatives throughout the state of California, especially in the Bay Area. I mean, low-income housing in Oakland is $1,800 for a studio. So as you go to the polls to vote, really know what your representatives, where they stand on public housing, where they stand on low-income housing, because as we go through COVID-19, we still have to worry about, HIV and people getting, their medicines and getting to the doctor and having a job. So we really need to know where we're going to house people when this comes crashing down. And that is going to be critical moving forward for the next 4 years, that we need to exercise how we feel in November when we vote.
Nora, I want to thank you for bringing that up. As you know, and as people may have heard, that COVID-19 is disproportionately impacting Black and Brown communities. And in addition to that, when you have disproportionate rates of people with HIV, underlying health issues, and here in Oakland, although we represent 23% of the population, Black people, we make up 70% of the homeless. We're 23% of the population. That is seen nationwide. And there are so many disparities that the person asks, what can they do? I agree with Nora, policy has to be impacted. Contact your representative today. I've been part of letter writing campaigns all year. So you can contact them today, your representative today, and bring these issues to their attention. But also find those organizations that are doing this direct service work and donate to them. Help them to help the people. I was saying earlier that I've been writing checks to people who are in danger of losing their housing. The only reason I'm able to do that is because people have donated to this center to help me to do that. So you got to find those organizations in your community. On our website, of course, you can we want you to donate to the center, but on our website, we have a list of community resources that you can look through and find places who are doing housing work like ours in your community, and help them. It really is about getting the resources to the people who are doing the work on the ground.
And I know that's what Until There's a Cure has done for a number of times, is provide funding and advocacy and support for organizations, as well as being on the ground themselves. So really appreciate your comments on that and reminding everybody to register and vote. I think we are running short on time right now, but what I want to remind everybody who's watching today is that we are going to provide a list of resources like Joe said, and Nora has provided some, Billy has provided some, that you all will be able to access both at our booth and also other ways. And I think through the chat, our colleague Jen has just shared a link that you can use to access some more resources. But I wanted to thank you all so very much. We can continue this conversation for hours, but thank you for joining today. The Oakland Athletics, Major League Baseball, the Giants, we're glad to be here. Until There's a Cure, of course, the Oakland LGBT Center, and then of course our panelists, Billy Bean, Nora, Hanna, and Joe Hawkins. I want to give a special thanks to all of our supportive colleagues at the Giants and at the Athletics, particularly Jen San Juan, who helped produce this panel today. Please enjoy the rest of your conference. Visit our booth for more resources. And thank you all so much for being a part of this continued conversation and this fight. Have a great conference. Thank you all.
Thank you, everyone.
Bye-bye.
Bye.
Bye.